Do you worry about getting older and what that means for your health, your teeth, and your bank balance as the thought of medical and dental bills looms in the background? Many people think it's inevitable that as you get older, you are going to lose your teeth, have gum disease, and your teeth will look worn and yellow. This is a bit like thinking that because people get old, that they're going to get sick and end up with heart disease or high blood pressure, be on lots of tablets and medications to have to manage their failing health. Well, these things simply aren't true, or at least they don't need to be, as this can be prevented with the right approach like good nutrition, exercise and self-care, and the same goes for your teeth. I'm Dr. Rachel, holistic dentist, and I want to talk to you about how to avoid 6 common dental problems as you get older. So whether you're over 50 or not, it's a good idea to start taking the best care of your teeth and gums today to set yourself up for the best possible future. We're living longer, and that's great. And we're also keeping our teeth longer than ever before, and the average number of people who are now keeping their teeth into old age is increasing. But it's not all smiles. As people keep their teeth longer, there are more problems that are likely to arise, which is why keeping up with regular dental visits is actually really important. So first, I'm going to run through what these 6 problems are. I'm going to go through each one in more detail, and I'm going to explain how you can fix them or what you can do to avoid them. So we're going to look at issues like tooth decay, but a specific type of tooth decay problem for older people, dry mouth, gum disease, mouth cancer, increased tooth crowding, and the issues of clenching and grinding as you get older. And as a bonus, I'm going to give you 5 simple steps to keep your teeth looking and feeling fantastic, so make sure you stay tuned for those. Tooth decay. Yes, people as they're older and over 50 do get cavities. You can get them on the surfaces of your teeth that have never been a problem before. You can get it around old fillings, crown and bridge work, or on the root of your tooth. Now, as you age, you get longer in the tooth. So the root of your tooth becomes exposed, and that is softer and more prone to decay. And when you get root decay, it can burrow down under the gum line. It can be very hard to detect until it's quite large, and it can very quickly and easily damage the nerve of your tooth because there's just not a lot of protection between that area and the outside world. So the fix is you could try fluoride gels and rinses, but if you want something more natural, then you need to be consuming a mineral-rich diet, getting plenty of vitamin D, and you can use hydroxyapatite gels, mouthwashes and toothpaste. You can use xylitol mints after meals. As I said, toothpaste with hydroxyapatite, which is the natural building block of your teeth. You can also ask your dentist about prescription gels and varnishes that can be applied to the roots and the teeth to help remineralize them and help them resist decay. Dry mouth. Your saliva protects your mouth against tooth decay, but as you age, or if you're on medications or have certain health conditions, you may not produce as much of it or enough of it, and your teeth will then end up being at risk of decay and gum disease. Your saliva contains the minerals calcium and phosphate, and they help prevent demineralization, which helps prevent cavities. How do you know if you've got a dry mouth? Well, you'll often have that sticky, parched feeling in your mouth, trouble swallowing, a dry throat, dry and cracked lips. You may notice a unpleasant metallic taste in your mouth, or you've got persistent bad breath, even though you may or may not feel thirsty. Dry mouth can be caused by medications, and as people age, they do take more medications due to their health. It can be a result of smoking or from health problems that damage the salivary glands. The fix is, if you've got a dry mouth, you should try and stimulate your saliva production so you can be sipping water during the day or chewing sugar-free xylitol gum to help get those saliva glands and juices going. but most of the times there just isn't enough saliva. And this means your mouth remains at risk. So in this case, your dentist can prescribe a prescription saliva substitute or recommend an over-the-counter formulation that you can try and help get the saliva and some moisture back in your mouth again. Gum disease. Now, if your gums are swollen, red, or they bleed more easily, you've got gingivitis, which is an early form of gum disease, and this can progress and be dangerous. Untreated gum disease becomes periodontitis, which is when your gums pull away from the tooth and it creates pockets that become infected. Left unchecked and untreated, gum disease will cause loss of the bone in your jaw and eventually tooth loss. And the teeth themselves, because they're just simply going to get loose and they'll fall out. Now, the risk of gum disease problems is higher the older you get, especially if you've got poor dental hygiene habits, if you've got crowded teeth, have poor dentistry that needs attention, you smoke, you're on medications, you have dry mouth, or you're post-menopausal. Now, the best fix for this condition is regular dental and hygienist visits, and by regular, you might need to visit your dentist more frequently than the recommended twice a year so that your teeth can be cleaned and your inflamed, infected gums can be treated. Now, this needs to be backed up by you at home. You need to be doing proper oral hygiene care, and that's going to include brushing, cleaning in between your teeth properly. You can be flossing using special brushes or a water flosser. Oral cancer. Now, the incidence of oral cancer definitely increases as people get older. It's very often linked to smoking and alcohol use. And recently, the number of cases of oral cancer has risen because doctors have discovered that the human papillomavirus, HPV, also causes oral cancer. Now, the fix is very important because if you get oral cancer, only about half the people who develop this type of cancer survive the disease. Now, the best hope for survival is to discover oral cancers at the earliest possible stage. So your dental exam should include a check for oral cancer. Your dentist should hold on to your tongue and they should check the soft tissues in your mouth as well as the throat and around the jaw. If he or she doesn't, then you need to ask them to do so or find another dentist. If you are a smoker, find ways to quit or at least cut down. Limit your alcohol consumption and have a diet high in antioxidants. Tooth crowding. You might be noticing that food is getting stuck in new places in your mouth, or that overlapping twisted tooth seems to be overlapping and turning even more. Well, this is because as you age, your teeth shift. And that can be problematic, not just because you're going to look different, but because it can make your teeth more difficult to clean, and that's going to lead to more decay and accelerated problems with gum disease. It's also a concern because misaligned teeth can lead to tooth wear and damage to the supporting tissues and bone. Crowding and moving teeth can also cause misaligned bites, making it harder to chew. It can lead to nighttime clenching and grinding as you sleep. Now, add to that fact that older adults tend to have gum disease, and you could end up losing your teeth faster because of all that excess pressure and movement of your teeth. Now, the fix is, if your teeth have really shifted, see your dentist. They may fit you with a retainer to stop the teeth from moving, or even braces to get them back into place. But that may not be necessary. You just need to discuss it with your dentist and see whether your teeth are shifting at your regular checkup. If they are, it may mean you need to go to your dentist more regularly for more frequent cleanings, as well as considering straightening your teeth. This leads me nicely into clenching and grinding. Now, this is not a problem that begins late in life, but it's one whose effects might be more pronounced as you age. If you tend to grind your teeth or clench them in your sleep, you may actually grind through the enamel to the dentine, which can cause pain and decay. Also, because of all this clenching and grinding pressure and hammering on the teeth, You can crack and split your teeth, especially the ones that are heavily filled or weak. And if you have crowns or bridges in your mouth, they may become damaged. Clenching and grinding tends to worsen with your age as your teeth get more crowded and the bite misaligns. Older adults tend to snore more and develop sleep apnea, and that is also linked to teeth clenching and grinding. So the fix: your dentist can make you a night guard or a sleep apnea or anti-snoring orthotic, and that will help protect your teeth while you sleep. It's going to stop you from cracking your teeth and your dental work. You could also look at trying some physio and supporting yourself with supplements that reduce muscle tightness like magnesium. There's also some studies that suggest that low vitamin D levels could be associated with teeth clenching. So it'd be a good idea to get your vitamin D levels checked. Now, there is a huge link between your dental health and your health. A healthy mouth allows you to live a healthier, longer life. And these common dental problems can be avoided. And I believe you deserve to have a healthy, beautiful smile that you can be proud of no matter what your age is. So here are 5 quick tips to keep your teeth looking and feeling fantastic. Number 1, practicing excellent home care, dental hygiene to help prevent dental issues. 2, choose foods that are good for your teeth and avoid foods that are going to stain them. 3, opt for the best dentistry you can afford and never settle for patch and repairs and quick fixes, because these are going to tend to fail. They're going to cause you more problems and more expense in the long run. 4, don't ignore bleeding gums, drifting teeth, crowding teeth, or pain. These are indications of infections and or underlying problems that need attention. 5, why don't you find out about whitening your teeth, how to improve your smile, and what to ask for when visiting your dentist to make sure your teeth can be kept at the tip-top, beautiful, looking amazing that you deserve. Now, I'm going to suggest you watch one of my most popular videos here to discover more about eating for great dental health, what foods to eat and what foods to avoid.